Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today, in our Conversation with Cancer Expert series, we have Dr. Dahlia Sano, who is Assistant Professor at the Rogel Cancer Center at the University of Michigan. And she's going to talk to us about some recent developments in chronic lymphocytic leukemia. We're honored to have her. Welcome, Dahlia.
Thank you so much, and thank you so much for the invite. I appreciate that.
Thank you for joining us. So we're going to talk about some select recent developments in this area. But before we do so, could you just give you a just broad overview of what is the armamentarium of drugs that we have for our treatment of CLL, and then we'll try to narrow it down to the specific abstracts that we have chosen for discussion.
Sure. So as we all know, the targeted therapy is now the way to go for CLL. BTK inhibitor, the first generation ibrutinib, and now we also have acalabrutinib, zanubrutinib, and pirtobrutinib approved as well. BCL2 inhibitor, venetoclax, is another important agent that also used as single agent or in combination. CAR T cell is one of the newer agent that recently approved for CLL. Monoclonal antibody typically used in combination with the targeted therapies. We have rituximab and obinutuzumab. Also, the chemotherapy drugs that uses fludarabine, cyclophosphamide, and bendamustine that we kind of not using as much currently as the more targeted agent.
So obviously, I guess the recent emphasis has been on BTK inhibitors and BCL2 inhibitors, and we've been using these drugs for a while. And lately, I guess we've started having some comparative data emerge on these. So what can you tell us about this trial with zanubrutinib and ibrutinib?
Sure. The Alpine trial looked at comparing zanubrutinib versus ibrutinib. Ibrutinib, as we know, is the first generation BTK inhibitor. Mainly looking at in the relapsed refractory CLL patient. The Alpine trial was a randomized phase 3 trial of zanubrutinib versus ibrutinib in patient with CLL relapse or refractory for more than one line of treatment and no prior BTK inhibitor.